Good afternoon, everyone. We will get started in just 1 minute. Good afternoon, and welcome to today's special webinar, COVID-19 and the Cooperative Business Community. This webinar is hosted by the National Cooperative Business Association in partnership with Dorsey and Marsh. Information provided will cover critical risk management and insurance strategies to mitigate potential business interruptions, as well as government relations actions and highlights regarding the impacts of COVID-19. This webinar is scheduled for 1 hour. Before we begin, just a bit of housekeeping. Participant phone lines will be muted during this presentation to reduce background noise. There will be a chance to pose questions, just not verbally. If you have a question, please type it into the question box on the GoToWebinar control panel on your screen. Questions will be collected and answered following each presentation. As time allows, additional questions may be answered toward the end of the program. NCBA CLUSA will be recording this program and will be archived on our website. You will receive an email containing a link to the posted recording early next week. With that said, I will turn the webinar over to our moderator and host, NCBA CLUSA President and CEO, Doug O'Brien.
Good afternoon, everyone, and thank you for taking the time today to join us for this very important conversation. As the Umbrella Association for Cooperative Businesses here in the United States, we are pleased to be able to provide this information and open this forum for discussion. I think all businesses, no matter their type, are focused on what COVID-19, the coronavirus, means for their staff, their customers, and community. I think cooperatives are distinctive in their special relationship with their members and with their communities. So we think it's an important conversation, and we look forward to hearing from our experts today and starting this conversation that will continue over the next days and weeks. Just very quickly, NCBA CLUSA, of course, we are a membership association here in the United States. We also have over 700 staff members worldwide engaging in cooperative development and other international development in 20 different countries. We here, in fact, I just right before this call extended our office closure in the DC office until April 1st. We continue full throttle in terms of our business and working virtually, but as many businesses in this region now across the country, we are taking precautions to protect our staff and our communities by closing the office. Just a bit of housekeeping. This webinar does not provide medical, public health, or legal advice. For specific guidance on public health, medical, or an actionable legal advice, we recommend that you contact a licensed practitioner or the most credible authorities in your area. Just to repeat a little bit what John Torres mentioned on question and answer. A key goal of this webinar is to provide our community with the opportunity to ask questions. And after each speaker, there will be about 5 minutes of question and answer. That will be curated through the chat line, so I'll have an opportunity to see your questions that you type in and be able to ask those questions of our experts. And then finally, I just want to mention, I'll mention again at the end, that we are creating a number of platforms and resources for the cooperative business community to provide more information to continue to support beyond this webinar. NCBA CLUSA has created a COVID-19 website and a survey. You can find links to both the website and the survey on our homepage, ncbaclusa.coop. This microsite or website will be regularly updated as we have new content to share with the community, and all participants to this webinar will receive the direct link to the microsite and survey after the conclusion of the webinar. Now, importantly, the survey will help us determine how to best to continue to serve the community, including the potential of future webinars or other types of information. So with no further ado, we have 3 people on our agenda today. As John Torres mentioned, we'll be talking about risk management and the mitigation of potential business interruption. And we'll also be talking about some of the policy implications, particularly some of the legislation, the disaster legislation that's being considered or has been considered by Congress in this fast-moving topic with our Director of Government Relations. But I want to start with Mike Doak with the Dorsey Law Firm. He joins us from the West Coast. Mike's practice is devoted to the areas of employment law, agriculture, and cooperative law with a special focus on food and agriculture industries. He's litigated employment and labor issues across the West Coast and advised across the United States. He acts as outside general counsel to a number of cooperatives, handles corporate governance, and manages complicated domestic and international transactions. So with that, Mike, thank you so much for being with us today, and I'm going to hand this over to you.
All right, terrific. And you forgot the most important part, which is that I reside in the state of Washington and work in Seattle. And so as a result of that, have been really at the forefront of the issues that we're facing right now in our community, both here locally and also more broadly nationally. As you said, Doug, I have had the privilege of working with a variety of different cooperatives, both in the agriculture space, in the food production, and also on the cooperative grocery side. I work a lot with NCG and other community cooperatives and the like, and I have really had a privilege of doing that. I myself started out life in a food services company, worked there for about 7 years, including in management, and then moved on to a management capacity in another company related, and then moved on to become a lawyer, and I've been practicing now for 27 years. So I kind of have a weird mishmash of background that I bring to the question. And I did wipe down, by the way. I encourage everybody to wipe down all their surfaces. I'll talk a little bit about some of the preventative things in just a moment. But in Washington State, as you know, the first reported tested case occurred in Washington. It was from somebody who had come recently from visits to China. But then very quickly on the heels of that, he had, by the way, been asymptomatic, but kind of going around in the community for about 2 to 3 weeks prior to that positive test. And then we had the first really novel case, not connected in any way to a foreign country, that occurred also here in Washington, and the first death, sadly, very tragically, that occurred in the United States as of about a week and a half ago, almost 2 weeks ago, Saturday. And when that happened, I realized that we, as a country, and in particular within our region here, but also more broadly, we're going to need to address this issue right away. And so we hopped on it. We did a webinar a week ago, Wednesday, and although I'll be totally honest, it feels like, although it was only 11 days ago or thereabouts, it feels like 2 lifetimes. We have had so much evolved since then. Sadly, the prediction that we made was true, namely that we're going to experience as much an economic crisis as also a public health crisis. And so employers and companies and businesses, and particularly those within communities like those in retail, need to be aware that that is what we're going to be facing. And so if you could advance, well, first of all, I'll just mention that at Dorsey.com, we also have a very comprehensive website devoted to coronavirus issues, and the webinar that we gave a week and a half ago is linked on that, so you can watch that as well. It's in regards to the employment law implications of coronavirus, and we listened to it this week and reconfirmed that the advice that we gave then is still as accurate now. I'll supplement that here in this presentation, but I do encourage people to listen to it. It's an hour-long program, very dense, lots of information. In addition to that, we've had some other resources like a webinar on Friday in regards to what are the impacts of coronavirus on your obligations contractually, and whether things like the force majeure concept could come into play here as we're dealing with this, rapidly evolving situation. So, Doug, if you could advance to my slide, I will say, kind of beginning with the. Oh, I'm sorry, it's on there. All my topics. Okay, great. So I will say, beginning with the end in mind, that this is happening to your co-op right now. You are experiencing the COVID virus walking around your store, walking around your business. They may not have been symptomatic yet. So there is an incubation period, as you hear. We're getting conflicting information about that right now. But there is some form of incubation period, somewhere between 3 to 5 and 14 days is what we're hearing. Obviously not medical advice. You should check with the CDC and your state epidemiologists. But there definitely are people who are asymptomatic or have very mild symptoms such that they're not aware that they're necessarily positive, but they're out in your community. And so I really recommend to everybody that you begin planning yesterday, and also that you separate out. It's interesting because the timing is such that we definitely are following a progression of how the disease occurs throughout a community. And so we here in Seattle are a couple weeks behind Italy, but we're a couple weeks ahead of Atlanta. And so it is easy to find comparison sets for your particular community to say, okay, here's where it is right now. We know that in 1 to 2 weeks, it's going to be like this. About an hour and a half ago, California shut down the LA County and San Diego school districts. Yesterday, Ohio shut down the school system. So even with very small numbers of reported tested cases, the governmental leaders and other business people are aware that the situation is much broader than what is tested and reported, because we don't have tests and reports, as you know. So really our recommendations stay the same, and I'm going to go through each of these with a little bit of detail so that you're aware of what our recommendations are as for the business community and business continuity. And I'd say particular for co-ops who are in the cooperative grocery industry, because you're going to be impacted very significantly. So first of all, come up with a scheduling, remote work, or cross-training program right away. And I mean right away, like a week ago, but for sure today, before you leave, come up with your scheduling plan, anticipating that you'll have staffing shortages of in the neighborhood of 50%. Those of you who've worked with me, I know many folks, I'm sure, of the 171 people who are logged in right now have talked to me in the past, and I'm not a reactionary person, but I will tell you that what we're seeing now is massive shifts in demand and massive shifts in the workforce. So for example, yesterday, the major local restaurant chains closed between now and May 1st because they had the bottom fallout of demand. So when schools close, then you have a shift of where the workers are, and when employees are requested to work from home, you have a shift out of the business operational zones and into the to where they live. And so you, each business, how that impacts them is a little bit different. And so you really need to look at it. So I'll give you some examples of what I mean by that. I'm working with one company, it's a food company. They have operations in downtown communities, but they also have operations in residential neighborhoods. They were able to rebalance their workforce so that people were moving out of the downtown where they knew demand was to drop and into the residential communities where people would be working from home and maybe need to purchase there at their location. Likewise, whereas some food companies have dropped, others have spiked. Milk producers are struggling to keep up with demand because people are buying more milk because their kids are going to be home. And also when they're working from home, air quotes, they are doing that from Starbucks or other, coffee shops. So they're buying more lattes, and therefore more milk is needed. So for each company, what your scheduling requirements will be, it's really going to vary significantly based on the kind of business you are, where you're located. Two natural food co-ops in the same community might have very different staffing needs as they anticipate. So I'd be looking at that. We have experienced here in Seattle a kind of rolling set of requirements. Those are available on the CDC's website. If you go to their coronavirus page, there's actually a recommendation for communities of Seattle, King County, New Rochelle, New York, and also for the Silicon Valley, so Santa Clara County. And I encourage you to look at those because it's a roadmap for what they'll be issuing in the next couple weeks as other communities catch up to the level of infection that we're seeing here. We know here locally, those of us in Seattle, that the numbers are underreported because just anecdotally, one person that knows 3 people who were sent home, and so it can't be as small as they're saying. And so I'm not trying to, engage in any kind of fear, but I do think realistically we need to be expecting that those numbers are going to increase as more testing occurs and more labs are authorized to do the testing. So yeah, you got to have your scheduling program now. And we've been recommending, for example, to extend out what schedules look like. So if you're a natural grocer, maybe you have you increase the capacity to do reshelving and stocking at night so that somebody whose kids are home during the day and used to be a front end employee now can be doing staffing on the back end, that kind of thing. Just being much more flexible. What we're calling here business is very unusual, doing that now. Second, before I actually go to the second point, as you're looking at work from home strategies, we definitely recommend that you consider both stress testing your IT systems to make sure that they'll actually work for that number of people. And then number 2 is to consider the data security. So I heard this morning on the news, I'm not, not quotable on this because I don't have personal knowledge, but that a very high percentage of general emails that are floating around about COVID information are phishing expeditions where they're trying to hack your system. And so training right away, looking at your IT systems, making sure that people are in VPN access, not using unsecured networks, so you don't have people driving around. Unfortunately, anytime there's a crisis, there are people with malintent who will want to take advantage of that. So just be really cautious about that. Number 2, I'm going to practice what I preach here, cough into my elbow. Tell your employees the plan and convey that information as you know it. So we've been doing here at the firm, at my law firm, I think a really good job of that. I commend them. First of all, saying we're on this. Second, here's the task force. Third, this is the task force is met. So providing information just as you have it in a way that's honest and accurate is really important. I think one of the aspects of this particular dilemma for businesses and workers is that we're not getting a lot of reliable information and the like. And so from the governmental sources or other sources. And so people are really afraid, and information is really the only way to attack that fear. And so I do recommend over communicating with your employees about your plan as it exists today. And then you don't have to necessarily disclose it now, but definitely watch the communities that have experienced these things. Go back in time to here in Seattle right now, because it could be that we are now where you will be in a week. And so think about, okay, if we were under the kind of restrictions that Seattle is under, no gatherings of more than 250, for example, people, then what impacts will that have on your business? And so be aware of that. So, again, over communications. We said this was on our slide even as of last Wednesday. Monitor school closings or other things that affect your employees so that you can respond to that and let people know that you're aware of that and responding to it. So school closings have happened here with very little notice. In other jurisdictions, they're starting them as of Monday. So you do have some notice, but here in Seattle, we had less than 12 hours notice of, well, actually a little bit more, just a little bit more than 12 hours notice that the Seattle city schools were closing entirely. And so just have a plan now of what you're going to do. If something happens, like a business near you decides to send all their employees home, or a school district closes. For example, restaurants in Seattle who were in or near Amazon, when Amazon said work from home, that radically affected their demand overnight. And so have a plan now so that when that occurs in your community, you can open up the plan, read it again, and then very quickly determine is this still accurate and execute on the plan. Fourth thing is really decide what you're going to do about sick leave and sick options. And I would encourage you to consider having a temporary unlimited sick leave program for the next period of time, 30 to 60 days. It's absolutely legally permitted to do that. You can have it begin and end. It's fine to say it's for a short duration or a shorter time, then you're going to reassess. But obviously for certain workers and in particular hourly employees, the loss of a day's shift could be very substantial to them. And so considering what you're going to do and how you're going to handle that and what limitations you're going to put on it, because it could be that it'd be economically impossible depending on the number of people who are out sick. But you definitely need to be thinking about how to handle folks that are feeling like they're ill, but they aren't necessarily so severely impacted that they're prevented to go to work, but you nonetheless need to keep them away. You also can require someone not to work if they're exhibiting symptoms. And so I encourage people to understand what the COVID-19 symptoms are. Go to the CDC website and continue to monitor that as we get more information about the situation. But it is acceptable to say, to ask people, do you have a fever of over 104? Do you have a 100.4? Do you have a cough, shortness of breath, et cetera, et cetera? So it's acceptable to ask those symptoms. We're getting a lot of questions right now about can you take employees' temperature? Unfortunately, we don't have really good guidance from the federal government on that at the moment. We did during the swine flu epidemic, and so you can look for H1N1 temperature, just search for it, and you'll see the EEOC guidance on that topic. And so I can't give legal advice on that right now, but we're definitely talking employers through whether that's a sensible plan. The use of temperature checks in other countries has been used, and so that's something we're fielding a lot of questions right now about. But kind of plan for people who are exhibiting symptoms, and then finally on the bullet point, although I do have one additional point to be recommending to you, is have a plan for what happens when, not if, but when you have an employee or a customer who reports that they were tested positive for COVID-19, because the chances of it happening are high, and it is so much better to have right now in somewhat the calm of the storm comparatively, which I can tell you because I've been through that storm for the last 2 weeks, and it was really calm back then 2 weeks ago. But in the calm of the storm, think about and identify what precisely are we going to do when somebody calls in and says, bad news, I just tested positive for COVID-19 and I've been working for the last 2 weeks. Or bad news, I tested positive for COVID-19 and I remember sneezing on the sneeze bar, but I don't know if anybody else touched it or the like. So that way when, hopefully it doesn't happen, but if it does, then you have a plan you can look at and say, okay, when when we were calm, this is what we're going to do. Does that still make sense? And you have something to execute right away. So we do highly recommend that. So then the final point I'll leave you with, and I'm happy to take some questions, is you look at the demand side, because the more steps you take to ensure safety, for example, you don't have to have employees wearing gloves at the front end of a cooperative grocery. However, if you did require that, you can, and that will convey a message that you're really taking the safety seriously to your customers, so you can keep demand going because they have trust in you that you're doing the right things. And so I do recommend doing more than is required, and taking pictures of it and sending it out to customers and letting them know you're still open, and making your website really clear about that, and just being really cautious about it. So anyway, I may have actually already been over my time, for which I apologize, but I'm happy to answer questions about what's happening here in Seattle as well, Doug.
Mike, that's great information, and particularly given your vantage point there in Seattle. Thanks so much. So we do have, you can, again, folks can put questions into the chat box, and we'll kind of curate those with my staff. Tamla Blaylock, our Vice President for Cooperative Relations, is tracking that. At this moment, I don't think we have any, which is okay, because Greg, I'm going to put you on notice that I think we'll move to you in just 1 minute. We'll have some time after Greg's presentation, and then we'll have some time at the end too. So we're running a little bit behind time, but I think the information that you shared, Mike, was terrifically valuable for 175 attendees that are on right now. So Greg, I am going to introduce Greg Benfield, who serves as the National Food and Beverage Practice Leader at Marsh. Marsh is a global leader in insurance brokerage and risk management, and Greg specializes in providing and coordinating risk management consulting services for large national food service clients. Greg, handing this off to you.
Thanks, Doug. It's great to be with everyone today, and hello to those of you on the webinar who I've met, and to those I haven't had the pleasure of meeting. I'm looking forward to meeting you in the future. During our time, I want to share a few thoughts, and have been asked to share around challenges and considerations and mitigation from an insurance and risk management perspective. I always like to use a quote in presentations, and I thought of this one that might be specific and appropriate when General Eisenhower once stated, "Plans are worthless, but planning is everything." Clearly, when we think of phrases today, we're hearing panic versus preparedness. And so being responsible and not sticking our heads in the sand. So typically panic doesn't last for a lengthy period of time. That's been my experience. In 35 years, I've witnessed this. In fact, those companies and individuals who have prepared for crisis definitely have a competitive advantage. And I think we're seeing that in certain sectors of the market today. And so as we begin, I'd like to share results. Just one of the questions that we recently asked just in the last couple of weeks of some of the clients and prospects in the food and beverage space. And the question was this: do companies have a business continuity plan or a pandemic preparedness plan in place to handle global outbreaks of pandemics? 17.9% said yes, and they have begun implementing the plan in China. 31.1% responded yes, but we've not implemented the plan. And 23.8% said no, but we are in the process of developing a plan. And 27.2% said no. A little staggering on that side of that. And again, some of these have been deployed since that survey of a couple of weeks ago. So as we talk about planning, I think for our co-op clients, it typically includes at a minimum the following 4 stages. One, that is document review, i.e., what is currently in place, when was it last updated? Secondly, a facilitated planning. And what I mean by a facilitated planning stage, in my experience, is it's generally good to include an outsider who knows the firm to facilitate the process and champion that, bringing all aspects of the firm together. Sometimes when we have operations guiding things or finance guiding things, it might go a little bit different angle. However, those groups should be included in this exercise. In many cases, we refer to that as a risk management, enterprise risk management. And so it's including not only operations and manufacturing, finance, distribution, retail, HR, but also bringing in procurement, tax and payroll, where all parties are involved. And the next stage around that is the plan development. And that is asking ourselves, what are the risks? And for us, what we typically like to see and recommend is a real blue sky or a whiteboard exercise, if you will. We don't know what we don't know, right? And lastly, the rollout of the plan. And I always like to use this phrase of educate, exercise, educate, exercise. Many folks use the word train. I was brought up that we train animals, but we educate people. So I always like to throw that in there. And I'm reminded in times such as these also of an old saying you've probably heard, I'm sure. We must all suffer from one of two pains, the pain of discipline or the pain of regret. And when it comes to business continuity planning and disaster preparedness, clearly it's a discipline and a muscle that requires a lot of regular use. So let's look at a few of the key components of a pandemic response plan. And I'll go through these quickly to leave time for some Q&A, but communications is one of the first that I think of. No surprise here that the topic is at the top of the list. And I could also easily state miscommunication, right? So all the things, Mike talked earlier about how fluid things are in the space right now and what the incubation period is. Is it 3.5 to 5 days? Is it 14 days? I've heard reports, you've heard reports, and we always need to fact check and question those. Policies and processes for our people, for our staff, our human capital, whether that's hygiene, whether it's leave of absence, travel, what are we doing working remotely? And then within policies and processes, I think of human resources and academic affairs. I think of health and safety, the legal aspect, governmental statutory with local bodies, and then critical processes. And I think of a couple scenarios here: loss of site or operation, or loss of people, or the human capital part. And then how does our plan align with other plans and procedures? And then lastly, again, educating and exercise. So as we considerate the mitigation aspect, one of the things that I would strongly encourage you to look at here is documentation. Document. Track what you're doing, track the expenses. How are your losses looking compared to the same time last year? This could be something as simple as engaging and tapping into the use of forensic accountants to track the financial loss. What are you doing with meetings, conference, and gatherings of your own or of industry? What the travel policies look like. And then, of course, on the supply chain side, are you a single source supplier for someone, or do you have a single source supplier? Last week when we held several calls, we also tapped into the communication around what are we doing with Asian suppliers? What are we doing with domestic suppliers that rely heavily on Asia? So in the epidemic and pandemic situations, we can generally expect challenges, whether it's a challenge of loss of large number of employees, or the mutual aid and assistance or the capability may be lost around that, or the critical services and systems that may be either unavailable or in some cases may be less effective than normal. So clearly differing from operating procedures and protective measures are required. Mike talked a little bit earlier about personal protective equipment and how we're dealing with that. Some of the other considerations include the self-quarantine. This is, again, these are plans that we've had in place for a while, and topics and theories and processes, and clearly where we are today, quarantine is very active as we've seen that. So, for those on the supermarket co-op side, clearly you're very aware of the increased foot traffic and provisions that are virtually, I refer to them as flying off the shelves. However, there are other segments, and some co-ops I know are on the call, in the retail restaurant space, where it's slowing down almost to abrupt foot traffic. So while we see the squeezing of the balloon in the supply chain from food and where those services are taking place, a lot of activity. And clearly from an insurance coverage perspective, there's a lot of thoughts there too. But Doug, I want to be sensitive to the time allotted and certainly have other thoughts and can speak on the topic for hours or days. But however, maybe this is the time where we could hear from the group if there are any questions, or do that at the end.
Greg, thanks. Thanks so much. I do have a couple questions here, and I'm going to pose them to both you, Greg, as well as Mike. And I'll emphasize that for questions that we don't get answers, we're going to track those and through our website. And as we think about other information in the future, we'll be trying to get those answered. One question has to do with if you have employees that are on travel, that are already out, domestically, or I suppose internationally, but probably mostly domestically here. The question is, should we have those staff come back as soon as possible, or continue to finish their trip?
So I'll talk to that. I think first of all, you need to think about it uniquely to your business. So there's no one size fits all kind of answer for your particular business. Second is that you need to think about what happens if the person gets stranded in a location for whatever reason. And so what are the implications of that for them, their family, and the like? And so I would have an answer to that question, anticipating that the employee themselves will be concerned about what happens if I'm in a particular location, and then for whatever reason that I'm not allowed to leave, or flights are shut down or the like. I myself traveled earlier this week and was on a virtually empty flight. So it is seriously impacting the travel industry right now, and the flights that are scheduled might be canceled and the like.
Yeah. Right. Thank you. I'll ask one more question here. And Mike, this might be another one for you. Do you, or Greg too, do either of you have recommendations for that sick leave or the paid time off? Mike, I think you mentioned that employees could consider doing, some type of unlimited, but ways to think about putting some structure around that, maybe?
Yeah, so I'll start with that, and Greg, maybe you could talk to it too if you'd like. But first of all, there's various states that have paid sick leave requirements, like California, and then some jurisdictions that are smaller, cities or counties like Seattle, have requirements. There are also, in some cases, paid family medical leave, and so a person might be eligible for family medical leave unpaid, or paid family medical leave if that is in their jurisdiction. But the real question is, so those are normal, if somebody's sick, they call in sick, they use their sick time, that's fine. But really for us, it's the business as abnormal. What happens if you have somebody who comes in and they exhibit a couple symptoms, not sure, you send them home? Are they entitled to sick time? And you should have a decision about that. If they've run out of PTO and you send them home, are you going to cover some cost associated with them, even though you don't have to legally? You should have a decision about that, just so that you can encourage people. Really, it's mostly about someone who's mildly symptomatic and encouraging them not to come in and infect others. That's the primary driver. And the secondary being very close, which is realistically, it has a major impact on families and lives to lose that income.
Mm-hmm.
And
yeah.
Doug, this is Greg. I'll add just a little practical piece that we experienced on some calls that we held last week with food companies, and many in the early stages were basically saying, we're not going to ask for doctors' excuses. We're just going to pay people if they have to be away. We would rather them not come to the site, whether that's a location, a manufacturing, processing, distribution, retail side of things, and they were paying them regular payroll. And it's going to be interesting to see how that moves forward. We're going to continue to hold weekly updated calls where we have this peer-to-peer conversation going on so everyone can compare and contrast notes. To Mike's point, there are regulations and laws that do vary by state, so we have to be uber sensitive to those.
Right. Okay, thanks. I have a few more questions here that hopefully we will have some time toward the end. But I do want to make some time because there's actually a few questions here that really talk about policy, federal and state policy. So I have an opportunity to introduce and hand it over to Kate Latour, who's the director of our government relations here at NCBA CLUSA. And Kate leads our advocacy work to ensure that policymakers understand why cooperatives are the best strategy for building businesses and communities. These days, Kate spends 24/7 focused on the very fluid situation in Congress, particularly around the bills, many of them kind of disaster bills that are focused on providing some type of relief for small businesses. And it's indeed a very fluid time, but there's some clarity on where some of the issues are, if not clarity exactly where Congress will land on some of it, and in fact, which type of cooperatives might be eligible. But Kate, I'm going to hand this over to you.
Awesome. Thank you so much. So I will just reiterate the caveat that things are changing fast as local, state, and federal entities are all implementing their plans. So the information I'm sharing is up to date as of about 10 minutes prior to my presentation of the webinar, but we'll continue to provide updates on information often, and you can always reach out to me directly if you have questions as things continue to evolve. So with that, last week, Congress passed legislation that was an emergency supplemental of appropriations. This provides additional funds to agencies directly responsible for public health, both internationally and domestically, but also, and very importantly, provides an additional $7 billion in funds to help small businesses across the country manage potential economic consequences from the outbreak. So this means that if your co-op is in a county or a contiguous county significantly impacted by the outbreak, it may be eligible for disaster assistance from the SBA in the form of what's called an economic injury disaster loan. Notably, in the current standard operating procedure, worker co-ops and small agriculture co-ops are eligible. In addition, if your business is in the startup stage, so you have not yet opened your doors, but your business may still be eligible for support, and if you can provide significant documentation, so things like advertisements or leases and other contracts that can demonstrate that. And additionally, for stuff on this webinar, private nonprofits and housing associations are also eligible, like I said, under the current disaster standard operating procedure. As it stands, consumer and marketing cooperatives are ineligible. However, NCBA CLUSA has been in touch with SBA's Office of Disaster Assistance and the Office of General Counsel there, and they're reviewing those regulations. There's currently some conflicting and just generally unclear advice and guidance related to producer, marketing, and consumer cooperatives that we're actively working to resolve. And we've also been in touch with Congress, making them aware of this issue. So if a legislative solution is needed, that they're ready to act. Importantly, SBA's Office of Disaster Assistance operates somewhat differently than SBA's biggest programs, that's 7A and 504 program, which many of you know through our work on the Main Street Employee Ownership Act, and the issue there being that their finance typically require a personal guarantee. So notably, their disaster assistance loans do not require a personal guarantee, and terms are determined largely on a case-by-case basis based upon the borrower's ability to repay. So as I mentioned, businesses must be located within a county that has received a disaster declaration or a contiguous county. Loans may be made up to $2 million based on actual economic injury to cover working capital needs like paying fixed debts, payroll, and accounts payable. Importantly, these loans cannot be used to replace lost sales or revenue. And as Greg mentioned, documentation is incredibly important, being able to demonstrate the economic injury that your business has experienced. Overall, eligible areas and additional requirements will be listed both on disasterloan.sba.gov, and we'll have links and additional information all available on our website dedicated to this issue. And so just by and large, the SBA doesn't have a lot of exposure to cooperative businesses, again, because co-ops are ineligible for their largest program. So with that, if your co-op is experiencing economic injury and economic distress as a result of the outbreak, I would encourage you to apply for that economic injury disaster loan. And if you are facing challenges in the application process, because you are a cooperative business, then contact your member of Congress for assistance. And if you wouldn't mind, please reach out to me as well, as I'll be tracking these issues, and those real life examples will help us kind of resolve the issue and provide context for folks on the Hill. So that legislation has been passed and enacted into law. And as Doug mentioned, the situation on Capitol Hill is highly fluid. As Congress puts into place plans for their own staff, conversations are definitely ongoing to finalize and pursue additional assistance measures. Right now, the House is looking to pass an assistance measure, hopefully by the end of today. Currently, they are still under negotiation with the White House. And so some assistance, some of those policies, including what Mike mentioned, particularly paid sick leave, paid emergency leave. So for example, if you can't go to work or your employee can't go to work because you're taking care of someone who is ill, or if a child's school is closed, the packages also will include unemployment insurance and food assistance measures. And the legislation has a component that may impact some of our home care cooperatives, that being a requirement for employers in the healthcare sector to establish a comprehensive infectious disease exposure control plan. So we're making sure that any assistance made available through the federal government, making sure that co-ops are eligible entities. And again, if you have any trouble, I encourage you to reach out to your members of Congress or me as well, and I can help you navigate that process. So for timing's sake, the bill is likely to pass the House today, but will still have to pass the Senate, so we'll extend into next week. Speaker Pelosi today also indicated that there will likely be another iteration of legislation coming as Congress knows more about how it's impacting the economy. So if and when there is legislative progress, we will update our website with that information. So please continue to check back. Moving on to actions by the administration. In President Trump's recent address to the nation 2 days ago, he stated that he intends to instruct the Department of Treasury to defer tax payments without interest penalties for both individuals and businesses negatively impacted by the virus. Importantly, an extended date has not yet been officially announced. So as it stands, tax returns remain due on April 15th until the IRS officially posts anything different. As I was preparing for the webinar, there was an announcement that President Trump is expected to make another announcement today at 3 p.m. Eastern, declaring a national emergency. So while this hasn't happened yet, it is expected to, and this action could direct as much as $40 billion in aid for states and local governments to deliver to individuals and businesses. Of course, that's taking place after the webinar. So again, we'll be sharing more information as it becomes available on our website. For small business concerns at the federal level, so that's Business Administration, USDA, Department of Commerce, I encourage you to reach out to your U.S. representatives and senators to see if they have made resources available to help the business community navigate federal programs. In particular, these offices may be able to help if your co-op faces challenges in applying for assistance. You can visit their website directly or call their offices. And I would recommend asking to speak with a caseworker who can assist with whichever agency from where you're looking to get assistance. So if you're applying for that economic injury disaster loan, make sure through SBA, then simply ask to speak with a caseworker who works with the SBA. And information on finding your elected official is also on NCBA CLUSA's website. Very quickly, at the state level, some states are making tax deadline accommodations for individuals and/or businesses affected by coronavirus. Currently, we are aware of changes in 5 states: California, Washington, Maryland, Georgia, and Ohio. Each state has put forward slightly different changes, ranging from extensions of a deadline to closing walk-in tax services and moving their operations entirely online. So if your co-op is in one of those states, I encourage you to visit our website, which has links to the Departments of Revenue announcements on these issues. And for states not mentioned, I would recommend you visit the website of your governor's office or the website of your state's Department of Revenue. And again, these are ongoing, and we will continue to update the information as we have it. And last but not least, depending on where your co-op is located, there also may be assistance made available through your local government. So please also check with your local officials on how they are helping businesses deal with any potential consequences of an outbreak in your community. Again, I really can't stress enough being proactive and asking for that assistance. It's their jobs to help you navigate the process. So I encourage you to do so.
Thank you, Kate. That's a lot of information, and even as we speak, some of it evolving both at the federal and state level. So we have about 6 or 7 minutes left. Kate, I'm going to ask you to repeat the SBA disaster loan website. Of course, we're going to have that information posted almost immediately after this webinar too, but could you repeat that, Kate?
Yes, that website is disasterloan.sba.gov.
Okay, great. And Michael and Greg, we really only have time for probably about 3. We'll end at the top of the hour. Business interruption insurance, whether for co-ops generally, or I think we got 2 or 3 particular questions for food co-ops. Generally, what should general managers and others be looking for in their insurance policies, and what might they find?
Yeah, great question. I anticipated that might come up, as it's been in several conversations. So first, I would say this up front, just a broad statement. Just because coverage is excluded under one policy, doesn't mean it might not be covered elsewhere under another policy. So from a business interruption perspective, and Doug, I don't know if there's any more color around that or not, business interruption, typically we think about that from a property loss perspective, where there's direct physical damage, and that is the trigger for the policy language to respond. In most cases, that's where we see from a property damage perspective. If we're looking from a business interruption loss, if there is direct physical damage, clearly we go back to the documentation. You log your hours of your staff, they're getting your business back up and running. Any extra expenses, if there's advertising, couponing, anything like that, if you have to procure the services of a forensic accountant to assist you into assembling your claim, there's a portion of the policies that we place where that is included, the rate for forensic accountants included. If we're talking about a different type of business interruption, that is, I can't get product, I'm unable to have product in the supply chain. If that supplier, if it's due to a loss of supplies to you that you can't complete or make your product to the public and available, if they have had a direct physical loss at their manufacturing distribution facility, then you would have what's called contingent business interruption coverage, and there could be coverage under your policy for that. If it's due to, think about back a few years ago when Oprah Winfrey made the statement at the Texas event and the cattlemen were very close by. She said, basically paraphrase, red meat's not good for you, right? And you saw this big dive of everybody falling. There's not an insurance product available for that today. However, there are other events. We created a policy 2 years ago with Munich Re and Metabiota and it's called Pathogen RX, and it's for things such as a COVID-19. It's for an epidemic event or a pandemic event. So Doug, I could go on with that. So I'm not certain if that answers the participant's question, but happy to go offline and have one-on-one with that as well.
Yeah. No, thanks, Greg. I think that certainly touches. Mike, you may have the last word on that. I think there is a lot of interest around that. Then I'll have some just a few quick closing comments, and we'll finish in just a couple minutes. Mike.
Yeah. So I think the comments about insurance are good. People should be looking at that to understand how things are going to unfold for them. And likewise, with some of the government programs that were described, Katie did a great job of that. It sounds like a lot is probably in the works. So there will be things happening. But I would just emphasize that if you have time to allocate right now, your time is going to be much better spent thinking about where are we going to be in 2 weeks. If if our community is like Seattle, and where will we be in during this presentation? Denver announced closures. So where are things going to be as the situation unfolds, and then, as Greg said, capture the evidence and documentation now, so that when you're in a position to make claims for your liability in the future, you can do that. But right now, I think the time is best spent planning.
Mike, that sounds like great advice. I want to thank all three of our panelists today. I want to thank everybody for joining. Just a couple quick housekeeping and important matters from NCBA CLUSA. We'll post the information that we gathered today. This webinar itself will be posted. We've created the microsite. We're inviting input and questions onto that microsite, onto that website that you can find linked on our homepage of ncbaclusa.coop. That microsite will be dynamic and updated as we have new content to share with the community. The questions that we were not able to get to today, all of our experts have agreed that they'd be willing to to engage and see if they can provide some responses. So we'll be doing that and either posting them on the website or sending those answers right back directly to people. Final thing I'll say is that just, again, thank everybody. And please note, there is a survey. We'll be sending a survey out almost immediately after this webinar to help us, NCBA CLUSA, serve you better, to understand what questions, what type of information that you'd find most helpful in this very unique situation. And finally, thank you for everything that you're doing at the local level. We know that co-ops are pillars of their communities, and now is a time more than ever for all members of the community to really focus and determine how they can best contribute and be part of the community. So again, thank you, everybody. And we look forward to continuing the conversation. Please take a look at our website, and I expect that we'll have more of these types of conversations. Thank you very much to our panelists, and everybody, please stay safe. Take care of yourself and your loved ones. Goodbye.
Thanks, Doug.
Thank you.